Today, I have the great honor of introducing you to Naonori Kodate, and now is Associate Professor in Social Policy and Social Robotics in the School of Social Policy, Social Work and Social Justice in UCD. And I will be speaking to him about automation, robots, and care. You are very welcome now.
Thank you so much. It's a great pleasure. Thanks so much for having me.
It's wonderful to have you. And so now let's start with you. Your work is so interdisciplinary and so internationally focused. Could you please tell the audience what makes you so passionate about what you do?
Okay, thanks so much, Patricia. Why am I passionate about interdisciplinary research? There are two reasons. First of all, health and social care are one of the pillars in welfare states and society. And the connection between policy and practice is just so vital. This is already interdisciplinary. Great policy has to be evidence-based, but if it's not appreciated by practitioners and implemented by them, it means nothing. And I've been working with care professionals since 2012 and also engineers for roughly the same length of time. So it's perhaps only natural that I feel so committed and passionate about interdisciplinary research. Secondly, my research deals with a particular social challenge that needs interdisciplinary research. The core of my research question is how we can collectively harness technological innovation safely and sustainably in the domain of care. And this issue regarding the relationship between technology and human society, perhaps I should also add prosperity is nothing new, which was highlighted by yesterday's Nobel Prize laureates in economic science. But the acceleration of technological advancements in robotics and AI makes this issue important and requires researchers from different disciplines to work together.
And I'm sure our audience will have lots of questions around that now, but you've been leading out on implementing a person-centered robotics-aided care system, and that's with Toyota and their hospital in Japan. And maybe you could give our audience a quick overview of this.
Okay, thank you. So the project I'm currently co-leading is a study jointly conducted by UCD, La Fondation France Japan in Paris, and Shiga University of Medical Science in Japan. And it's funded by Toyota Motor Corporation and Toyota Frontier Research Center. And the background to this project was a regional large hospital with more than 500 beds in the middle of Japan was going to be refurbished and rebuilt completely. And the introduction of autonomous transfer robots was agreed upon as part of a new model of care delivery system. And we social scientists working with engineers and care professionals are measuring the impact of using these robots on care and service delivery, while trying to understand the perceptions of users and stakeholders, including patients, regarding the implementation of this particular transfer robot called Potaro in this hospital. What's unique about this project probably is the robotics developers and healthcare practitioners have been working together from the design stage to the deployment stage. They really wanted to measure the impact, not just the short-term impact, but the long-term impact of using their robots in the hospital, particularly the way in which nurses, medical technologists, and also pharmacists work. Not just kind of their work performance and efficiency side, but also well-being. And perhaps the audience wants to take a look at how the robots actually work. So these actually YouTube links that have been shared would highlight that. You could have a look. Toyota as a company obviously is known for automobiles, and they are interested in this type of mobility-related transfer robots to release time for providing care in this particular hospital. But as you may know, they're also building a future-oriented town called Woven City in Susono City at the foot of Mountain Fuji. And they are looking at the way in which technologies can enhance well-being living in communities.
Incredible. Look, this is all incredible. And there's so much that you've just unpacked there that our audience, I'm sure, has plenty of questions on that. And all I can say is, wow, this is incredible, original challenge-based research that you've been doing right from the design phase to and all about impact. But I think just my last question to you is, what I'm hearing raises I suppose, so many questions around unintended consequences, and maybe you can give just a high level of some of your thoughts around the ethical concerns using robots in care settings.
Yeah, thank you. That's really important aspect of my research. And probably on this point, I could talk a little bit about other international comparative studies I've been co-leading together with my UCD colleagues in social work and healthcare, health systems, as well as computer science and researchers in Japan, Finland, and Ireland. A tri-country questionnaire study we conducted a couple of years ago dealt with ethical perceptions towards home care robots. We asked older people themselves, family carers, and care professionals to respond to our questionnaires. Sort of, we were conscious that, as opposed to many questionnaires conducted before ours, they were the actual and potential users of robots, not people who are not receiving care or providing care. And many robots in the past were developed from the point of view of someone else, sort of neglecting ethical aspects as well as users' needs and preferences. One thing we found from this study was that in all three countries, Finland, Ireland, Japan, people are highly concerned about the kind of replacement of human carers by robots, and would like to have some regulations and legal guarantee that people are entitled to human care, even part of care delivery becomes automated. I believe also, I have also been conducting research in nursing homes, where various types of robots and assistive technologies, sensors and monitors are deployed and used very sensibly by care professionals. But one common key factor we found for their safe, ethical, and sustainable use is really trusting each other. So between care recipients and care professionals, sometimes care managers, and also family members of care recipients. It might be a little bit contradictory, but trusting AI robotics really comes down to trusting humans. And coming back around to starting point of our conversation, it really needs interdisciplinary international research collaborations. We also need to probably discuss these matters of care with policymakers and citizens, examining the impact of automation on human-to-human interactions, policy and practice in different cultural and organizational contexts.
You've so eloquently pointed out the need for, challenge-based research is all about building interdisciplinary teams, and I'd say there's so many questions coming in, and I'm going to try and get through them all. But the first question is around woven city. So this is, you've just described it there, and there's a link in the chat for people, and so this is, I believe, where tech and caregiving coexist. And is it specific for aging populations? Our question wants to know, our audience member wants to know, or what maybe you could just give the vision.
Yeah, this is actually for all generations, and it's not just particularly for people, like, for example, like it's not like dementia care village, for example. So it is kind of a test case where technologies can be introduced to the actual life, like living in community, for younger families with kids, as well as people who need care. So this is sort of a slightly separate from my research targets. But my point I was trying to make was Toyota is really looking at the kind of technologies used within broader sort of a community setting.
Yes, that's incredible. And if a question here from Nate O'Connor. So it's long, so bear with me now. When it comes to care and robotics, is there an evolving division of labor with robots doing more manual tasks, leaving more time for humans to provide the personal touch? Or is it the mix of robots and humans ultimately driven by cost efficiency as the bottom line, with a potential loss of personal touch despite the assistance of robots?
Yeah, thanks so much, Nat. It's actually another key point aspect of my research. I think long-term consequence we still don't know, and that's where I think trusting humans and actually humans delivering care and actually delivering care and communication included, not just which you mentioned as human touch. Is critical. And at the moment, I think particularly in nursing homes, care has not been really measured. The quality and safety aspects have been measured now, like in kind of component and task based. So tasks some of the tasks have been delegated to robots in some respects, particularly around physical aspects. So physical assistive robots have been introduced to help people sort of move, people transfer all the people from bed and so on. And socially assistive robots, that's where I think some concerns I have in relation to communication. And if older people are left with robots and no care workers or care professionals actually tend, or family carers don't go anywhere near, I think that's where the danger, some of the issues would come in.
There's so many unintended consequences, and we hear so many stories about, people marrying robots, making humanoids of themselves. We just, there's so much going on in that space. But I there's another question here around how busy our care providers are now, and I suppose from your study that was found that they were losing communication skills. I don't know if you want to talk a little bit about that.
Yeah, thank you. So I guess there is kind of a policy discourse when these technologies are introduced, or sort of the use of technologies is justified. And I think not replace, but supplement, and because the huge shortage of kind of professionals there in care sector, not just in Japan, but across many places and in many places. And I think it's the when it's introduced, how they are introduced is so important. And over time, that has an impact. So if people actually get used to just using it without thinking that aspect of care as kind of a processes of delivering care, and then I think communication skills or even other types of skills might be actually lost over time. And some care managers are very conscious of these aspects. So they don't necessarily want to bring those technologies to sort of fill the gaps. But when it comes to delivering care during the night, for example, night shifts, it's so tough and challenging. And that's one of the main reasons why people don't necessarily want to go into that sector as care professionals. So technologies can really help during that, night shifts and so on. So there are kind of pros and cons, and they kind of appropriate places where technologies can be used wisely.
But it's so important to have humans in as part of it, as you always say. So just some more questions coming in. One around, are you aware of any studies that evaluate the use of AI and assistive technology in relation to delivering speech therapy to people living with intellectual disability or brain injury?
I'm not aware. I mean, there are studies I know, but I can't single out like this particular study is kind of significant. And I mean, but there are studies around all kind of a communication, speech therapy, I mean, a kind of rehabilitation aspects for people with disabilities across the board, from speech to movement and mobility and so on. So yes, there are studies. I mean, it's not particularly coming out of Japan or anywhere. In Nordic countries in particular, they are very strong in use of exoskeletons and so on as well.
Yeah, I suppose just this whole idea of robots improving care, improving patient safety, like you spoke about. I mean, what does the future look like now? I mean, how, and maybe just a word, maybe we'll end on this, your kind of take on the caution that we need as
yes,
human race, basically.
Yes, thank you so much, Patricia. I mean, I started off looking at sort of human robotics, human robot interaction. There are a lot of people from, again, various disciplines who are interested in these aspects, interface, between the technology and humans and so on. But what comes out very strongly each time I go into nursing homes where those technologies are used is really human to human aspects. The way care professionals try to use robots to create more sociality and interactions amongst themselves. So they are aware of the importance of human-to-human contact in care settings. But again, if we use more and more of these technologies, being kind of unaware of the kind of the whole process of delivering care and the impact of each process on human, like particularly people who receive care, especially if they don't have, if they have cognitive impairments and dementia and so on and so forth, and also disabilities, then that I think has to be really brought out very strongly to not just to researchers like ourselves, but also care professionals, care managers, and policymakers, and even citizens and politicians. And that's why we really need to look at this issue from kind of a multiple level aspects in society.
And it brings it right back to the start, as you said, great policy, great practice. I mean, I think that's a really good way to finish off, because we are completely out of time. And sincere apologies to all of you whose questions I did not get to, but I just wanted to say this, take this opportunity to say a huge thank you to Nao for the most fascinating discussion today.
Thank you so much, Patricia.
Thank you so much, Nao, and thank you to everybody for joining in. And please do check out our website for our list of upcoming speakers. We really have some great speakers on this series. So see you all very soon on the next UCD HIT series. Thank you so much, everybody. Take care. Bye.